New See Walk Hard, Hello Doctor. Brought to you by Walk Hard Hospitals towards saving lives.
नमस्कार. हॅलो दोतोर कार्यावळीन आज तुमकां परतून एकदा येवकार. आयचे कार्यावळ आमचे बरोबर आसात गोयचे नामनेचे हाडांचे तज्ञ डॉक्टर जे सुपर स्पेशलिस्ट आसा म्हणजे जेणे MCH म्हणजे पोस्ट म्हणजे स्पेशलायझेशन म्हणजे MS करून मागीर परत सुपर स्पेशलायझेशन केला ते डॉक्टर मुदीत खन्ना आणि ही आसा तांची ओळख.
डॉक्टर मुदीत खन्नान MBBS आणि MS डिग्री किंग जॉर्जिस मेडिकल कॉलेज लखनौच्यान पुराय केली. तांची खासियत म्हणल्यार एडवान्स जॉइंट रिप्लेसमेंट आणि एडवान्स स्पोर्ट्स ऑर्थोपेडिक्स. सध्या ते कुंकळेच्या न्यू सी वोकार्ट हॉस्पिटलान एडवान्स जॉइंट रिप्लेसमेंट सर्जन म्हणून वावुरतात.
डॉक्टर मुदीत नमस्कार, वेलकम. आयकूप येनो एक म्हत्वाची गोष्ट म्हणजे डॉक्टर मुदीत खन्ना गोंया भायले आशिल्ल्यान तांकां कोंकणी सारकी कळना. तरी पण तुमच्यांनी आमकां कोंकणींतल्यान प्रश्न विचारूं येता. आमचो नंबर आसा 24904444 आणि 24904445. ह्या दोनांपैकी खंयच्या एका नंबराचेर फोन करात आणि फोन करतना तुमच्या घरा कडल्या टीव्हीचो आवाज कमी करात किंवा बंद करात. कांय तांत्रीक बिघाडाक लागून आयची कार्यावळ थोडीशी लेट सुरू जाल्या तरी पण आमी सुरू करता आणि तुमच्या प्रश्नांक आमी रावतात. तुमचे प्रश्न हाडांच्या दुयेंसा विशीं जे संबंधित प्रश्न आसा कितें ही इज रियली अ सुपर स्पेशलिस्ट आय शूड से आणि ऑथर ताणें पुस्तकांय बरयल्या जी वैजकी मळावेल्या कितलेशेच विद्यार्थ्यांक मार्गदर्शक थारल्या. As compared to your young age, I think you have done a lot of clinical work apart from academic performances, and you have been author of many books. So I welcome you, sir.
Thanks a lot. It's
Dr. Mudit, it's a really pleasure to be with you because I think, if I'm not mistaken, we are in the schedule of the World Arthritis Day. So World Arthritis Day म्हणजे जी दुयेंसां असतात म्हणजे आर्थरायटीस सारखी त्याच्या विशीं लोकांच्या मदीं जागृतकाय जावची म्हणून हो दीस सबंद जगभर मनयतात. Then just as a beginning, what I would like to say, since now you are in Goa, what type of illnesses related to arthritis are seen commonly in Goan population?
Well, what I have observed really is that arthritis does appear to be very rampant in Goa in general.
Yeah.
So we've got a mix of various forms of arthritis. We've got the wear and tear arthritis, as we call as degenerative arthritis or osteoarthritis. Yeah. And then we have another group of arthritis which is inflammatory arthritis like rheumatoid arthritis. Essentially, young people, young patients who suffer from arthritis have an inflammatory kind of arthritis, while the elderly usually suffer from osteoarthritis or degenerative arthritis. And they are uniformly mixed in Goa, and both really have a different approach to treatment.
And second thing, what I like means, what are the guidelines when you decide like this particular gentleman or a person or lady or whoever is a patient requires joint replacement surgery? Like, what is your guideline as far as clinical assessment is concerned?
Yeah, well, there are. It is a difficult decision most of the times. Basically, what I would stress on is that we recommend joint replacement surgery on a number of factors. One is the patient factors and the other is the surgeon decides on the basis of certain clinical findings as such. The patient factors are essentially when the patient feels that the pain or deformity is significant enough to interfere with activities of daily living. Right. Now these activities of daily living can be different for different people. Right. So if somebody wants to be able to go upstairs, go downstairs, maybe go out in the park for a walk, his requirements are different from somebody who probably is happy just being around the house, just from up to the kitchen, back to the bed. So that is in terms of the patient.
Yeah. Doctor, I'm just interrupting. I think we have received one question. Hello? Hello?
Hello?
Yeah.
हांव सिरंग नार्वेकार म्हापशेसून उलयतां.
सिरंग नार्वेकर बाब नमस्कार. विचारा तुमचो प्रश्न.
संधिवात जावं हे जे आसा रोग हाडाचे रोग ते जास्त खावप आणि व्यायाम करप ना ह्या खातीर जाता अशें दोतोर म्हणटात. आमची भुरगीं इस्कोलाक वयतात जावं शाळेंत वयतात ती चिप्स खातात जावं आनी कितें चणे सुरमुरे खातात. आमचे तरणाटे आसात ते सगळे चायनीज खातात
हय
आणि जाणटे सुद्धा काय फाटी ना
हय
जाणटे सुद्धा हे चायनीज खातात
हय
तर आम्ही कितें खावप
या
म्हणजे आमकां हे रोग जावचे ना
या
हे तुम्ही सांगा आणि व्यायाम आम्ही कसल्या तरेचो करप
बरें आसा good. Just I will translate this question in a nutshell. This gentleman, Mr. Sriram Narvekar, has asked us, he wants to know what type of diet you recommend to keep our joints healthy and happy. Second thing, because he is saying, he's talking about the fast foods and all this junk food which people are consuming a lot. So he's relating that whether it is associated with these illnesses of the arthritis and all. And second thing, what type of exercises you recommend to keep all your body fit as far as joints are concerned.
Sure. See, in terms of diet, there is arthritis essentially means that the cartilage gets worn out or degenerated. Now, diet has no direct relation to degeneration of the cartilage. So, anything that you eat is not going to harm your joints per se.
Yeah.
However, obesity has a direct impact on the joints.
Yeah. जस्ट इन श्रीरंग बाब ते सांगतात की तांच्यांनी सांगला की डायटाचो डायरेक्ट रिलेशनशीप ना पण जेन्ना तुमचें वजन वाडटा तेन्ना ताचे हार्मफुल इफेक्ट्स म्हणजे तुमच्या जॉइंटाचेर दिसून येतात. येस कॅरी ऑन सर.
So if you have a diet which is prone to make you gain weight, you are increasing the chances of developing arthritis. But as such, there is nothing that you need to avoid. You can have everything in a decent proportion. A balanced diet is good for everything, not just the joints.
Yes, yes. And what type of exercises do you recommend?
Now, it's again a very difficult question because lots of people ask me that we do the exercises that Baba Ramdev has recommended and whether we should continue doing them or not. Well, in essence, I think exercise is always good. So you need to keep your joints moving when you have arthritis.
Correct.
If you have arthritis and you stop moving your joints, they get more and more stiff. So keep moving them. How much you can move them depends on how much you are comfortable with. Don't do anything that is stressing your joints.
अच्छा म्हणजे थोडक्यात श्रीरंग बाबा तुम्ही प्रश्नाची जाप अशी आसा की जे तुमचे जॉइंट्स मुवमेंट्स करतात आणि करू शकता त्यांच्या एबिलिटी प्रमाणे ते जॉइंट्स मुव्हिंग दवरप खूप गरजेचे आसा. कांयच न करप वायट आणि तांच्यानी सांगला आहार सुद्धा जरी तांच्यानी सांगले की डायरेक्ट रिलेशनशीप ना पण बॅलन्स डायट म्हणजे संतुलित आहार खूप गरजेचो. फास्ट फुडापेक्षा हो संतुलित आहार जो आसा तो तुमकां सगळ्या दृश्टीन फिट दवरतलो. I think we have received one more question, sir. Hello.
हॅलो
Yeah.
हॅलो
Yeah, ऐकून येता विचारात.
हांव वास्को सांग उलयतां जुझे फेर्नांडीस.
या जुझे बाब विचारात.
हां
विचारात प्रश्न विचारात.
माझी भायले जाव कोणच्या एकदम हे दुखता 5 महिने जाले.
हां
कोणच्या सारखी दुखता फोडटा
नाही खंय दुखता म्हटल्यार दाव पाय खंय दुखता.
कोणच्या म्हणजे खोंटेकडे.
कोटेकडे अच्छा ओके. Since 5-6 days, this gentleman's wife is suffering from the pain in the heel of the left leg, which is also quite commonly seen problem, especially among the teachers and other professionals. I would like you to clarify this little broader aspect.
Right. See, the most common cause of pain in the heel is something called as plantar fasciitis, where the fascia, which is at the sole of the foot, gets stretched and tight. It is worst when you first get up in the morning. It feels like you're walking on stones or pebbles. Essentially, the treatment is threefold. Initially, we try to get rid of the symptoms by exercise, certain group of exercises that are there to stretch the plantar fascia. We give you a short course of anti-inflammatory medicines to cut the inflammation down. And we advise different kinds of fomentation, along with a soft heel in terms of footwear modification. In most patients, if they follow it strictly, this helps in relieving the pain. If this does not work, we next move on to the next step, which is an injection that we give at the point which is maximally tender, essentially at the point where the fascia inserts. And if that doesn't work either, after a long trial, there are surgical options as well. But most patients find relief with the set of exercises plus medications and footwear modification.
अच्छा जुझे बाबांच्या प्रश्नाची जाप अशी आशिल्ली की थोडेशे एक्सरसाइजीस जे डॉक्टरांक मेळ्ळ्या उपरांत ते तुमकां सांगतात ते करूं येता ते केल्यार पेन कमी जावं शकता. ताच्या बरोबर थोड्योश्यो गुळयो घेवपाची वखदां असतात ताच्यानूय बरें दिसता. समजा ते जर प्रकार फेल जालो जाल्यार एक इंजेक्शन असतात जंय तो मसल म्हणजे फेशिया इन्सर्ट जाता थंय करचें पडटा. सगळेच उपाय जर हल्ले जाल्यार ऑपरेशनाचो ऑप्शन घेवचोच पडटा. पण चडशे फावटी हे जे बाकीचे वखदां किंवा एक्सरसाइज तांचो उपयोग जाता आनी तातूंतल्यान बरें दिसूं शकता. माय सर वी हॅव टेकन वी आर गेटिंग अनदर लायन ऑन द क्वेश्चन. हॅलो
हॅलो
या
मारिया फेर्नांडीस
नुवे विचार बाय.
डॉक्टर मुगे दोन्ही दिम्या दोंपरां भासीचे दोतरे उडोवन फुटले आनी आमी गोडे गोडे दोतरे पडा आनी ते म्हाका लिगामेंट आहाय ते म्हाका उसट आहाय दोनी आनी जीएमसी तू दोतरांगे वखद कोता म्हणून म्हाका ते कांय लागना दुसरे मुगे ही सगळे जॉयंट हातींचे बाय ते आड ऊंच सोले मुजी आनी दुखताय आनी काम बा करपा एकदम त्रास जाताय म्हाका.
पिराय कितली तुमची?
म्हाका 63.
अच्छा ओके.
आनी
विचारात
अशें मुगे जिवा अशें तेश को एक्टिव आहा हांव पूण हे म्हाका जॉयंटा लागून त्रास जाता.
बरें वजन कितलें आसा? वजन कितलें आसा?
सांग म्हाका.
वजन कितलें आसा?
वजन मुगेलें 42.
बरें आसा गुड. She is 42 kg, 63 years old female, must be definitely menopausal. She is having a lot of pain in the different joints and she met with some accidents. So both her knee joints are paining since that and she wants to have a little...
Yeah. First of all, I would compliment you on your weight. So one of the most important reasons to give you joint pain is not the case in your case, right? Now, it really, what you need is an entire assessment. When you have pain that is affecting more than the normal weight bearing joints, primarily the knees, when you have pain which is affecting all the joints of your body, the cause is usually inflammatory or systemic, as we started in the beginning of the program. So what we need to do is examine you, do certain blood tests to see whether your inflammatory markers are high. One of the inflammatory markers that we often use is called as an ESR or your CRP. Try to find out the cause of the problem, and then once we know we have a differential diagnosis, we know that X, Y or Z could be causing it, then treat the same. There may be two things running side by side as well. Pain in the knees may be different from pain in the other joints of the body, but it needs a complete evaluation.
Doctor, I would like to just drag on this question a little further. What is your opinion about this increased serum uric acid level and pain which occurs out of that?
See, it's again a very important question. I see a lot of patients who get blood tests done, have an elevated uric acid, and are put on medications to lower the uric acid levels. Asymptomatic hyperuricemia is not an indication of treatment.
I see.
Okay. Yeah. So unless until the pain that you're having in your joints is directly caused by uric acid levels, you don't need treatment for gout.
Yeah.
Okay. So if you have diffuse pain in the joints, that is not how gout usually presents.
Yeah.
If you have an acute red, hot, swollen joint which stays swollen like that for a few days, is relieved by anti-inflammatories, and at that time if you do a uric acid level which increase, that is a clinical reason for us to believe that your symptoms are from gout and you need to be treated for that. On the other hand, if you have diffuse pain involving most of your joints and your uric acid levels are elevated, it does not essentially mean that you have gout. So that is those cases that do not need treatment as such.
Hello, thank you. Hello sir. Hello. Hello.
Hello.
Yeah. विचार प्रश्न विचार आमकां ऐकू येता. युआर ऑनलायन.
हांव मडगांवच्यान अंजली बाळे उलयतालें.
अंजली बाई विचार.
थोडे दीस पयलीं म्हज्या घोवाचें ऑपरेशन केल्लें डॉक्टर मुदीत खन्नान.
अच्छा, कसलें?
ते दोतोराक हांव मुद्दाम थँक्यू म्हणपा खातीर हांवें मुद्दाम फोन केला. तांकां टीव्हीचेर पळोवन म्हाका बरी खुशालकाय भोगली.
अच्छा, नाही कसलें ऑपरेशन केल्लें? या अंजली बाई ऑपरेशन कसलें केल्लें? ऑपरेशन कसलें केल्लें?
नी रिप्लेसमेंट उजवे पायाचे.
अच्छा अच्छा. कितको तेंप जालो? कितलो तेंप जालो ऑपरेशन करून?
15 दीस जावन गेले, पूण रिस्की आसून सुद्दां बरें सगळें सक्सेसफूल जालें बी. आनीक तो त्या दोतोराच्या खातीर मुद्दाम सांगपाक गेले, इतलो फ्रेंडली आनी इतलो हेल्पफूल डॉक्टर खंयच्याय टायमार रातचो सुद्दां करून फोन बीन घेता, अशी दोतोर मेळपाक कठीण.
अच्छा. Yeah, thank you very much. Dr. Mudit, I must compliment you. This phone was from one of your well-wishers. You have operated on her husband's knee for a joint replacement. She is pleased by your personality and your approach and friendly approach. Especially you receive and accept the calls even at the odd times of the hour and the day. So ही सगळ्या खातीर अतिशय महत्वाची गजाल. कारण असे जे डॉक्टर आमचे कडेन ह्या कार्यावळीन बसतात तांकां अशे क्वचितच लोकांचे कॉम्प्लिमेंट्स येतात की तुमचे कडेन ट्रिटमेंटान आमकां बरें दिसलें, तुमचो अप्रोच बरो आशिल्लो, तुमचो सहवास बरो आशिल्लो, तुमचो मैत्रीपूर्ण व्यवहार आशिल्लो. खंयच्या वेळार फोन केल्यार तुमी तो घेतात किंवा आमकां एक्सेप्ट म्हणजे आमकां मार्गदर्शन करतात. And I think this is also a type of achievement I must compliment you, because often people feel the specialists and super specialists are like you,